doctor did not have a red top, as it is often shown on the news and most people are used to. The top was gray. It was a gray top vial. Okay. Put it in the bag. We're going downstairs. Once I get down there, I'm looking for a scanner. I find the patient. I do all the things I'm supposed to do. I let her know why I'm there. I verify who she is. I can't find anything to barcode scan the administration of this drug. The nuclear med tech tells me we don't have that down here. There's no barcode scanner. I say, okay, I'll do this later when I get back upstairs. Pop this out, look at the reconstitution rate on the back. I'm sure at some point, I looked at the name of this drug and read it to be what I had already confirmed in my mind that I had typed in, which was Versed, VE, and we do these things very quickly. Look-alike, sound-alike drugs. It's one of the most common factors in medication administration errors. Look-alike, sound-alike drugs. We talk about this in your pharmacy classes. These mistakes are real. This was a look-alike, sound-alike situation. If I read it closely, I would have seen that, but you have this confirmation bias. I have told the machine what I need. Literally the entire name of it, what I need. The only thing that it should have given me as a result was exactly what I needed. Okay. I reconstitute the medication. I give her 1 ml of it. It's 10 milligrams for every 10 milliliters. I put a whole thing of, normal saline in there, 10 ml syringe, give her the 1 ml, flush before, flush after. The med tech is there. She's waiting to take the patient back to the scan. That's my assumption. She says nothing to me about staying with the patient. I say nothing to her about staying with the patient. She believed that the young man that was with me was the primary nurse. She didn't know this was an orientee. She was wondering why I was down there giving medication when she'd already talked to this guy upstairs who told her he couldn't come and that he was going to send someone. And there was this whole back and forth about him not being able to come at all originally. Also, there was conversation about she felt like someone needed to stay with the patient and monitor them.
Between the two of you?
Between her and the primary nurse. So when I came downstairs with a young man,
She assumed it was the
she
primary
assumed that
nurse.
he was the primary nurse. And she never said anything to me. I didn't pick up on, sometimes you pick up on a weird vibe or
Yeah.
whatever. She didn't have a lot of extra things to say, but again, I'm assuming she's in a hurry. They're waiting on me, to give this med so they can get the patient in because there's a timestamp there. I respect that. I'm not trying to get in the way of your job. She didn't say anything to me. I didn't say anything to her. She assumes that this guy is the nurse that she's been talking to. It isn't. She takes the patient one way. I assume it's into the scanner. It wasn't. It was into a lead-lined room where she was still waiting to go into the scanner. And I went to the ER, eventually made our way back upstairs. Sometime within 15 minutes, I'm giving the bag with the rest of the medication back to the nurse, the primary nurse, because I don't want it in my pocket while I'm in and out of the rooms. Also, I haven't documented it. Also, we need to waste it. You need to keep this here. You have a locked cabinet with supplies. You can keep that in there. You'll know when the patient arrives back to the unit because it's your patient. You can call me. I'll come. I'll have all the things I need. I'll have myself. I'll have the drug. I'll have the computer with a scanner. And I'll have a patient with an armband because Epic knows the difference between an armband and a peel and stick from her barcode chart. So I need all of those things. Let me know when she gets back. I'll do this. And then, we need to waste this in the AccuDose or Pyxis or whatever and then dispose of it. Cool. I've got this phone I'm carrying. It's really loud. It's a radio phone. All the rapid response calls come over it. The code goes off, rapid response, PET scan, no names. We try to call. We don't get any information. No one answers. Her family members hear this. They're right there. They're concerned. I go to the charge nurse, tell her what's happening. We try to call again. Can't get any answer. We decide we're going to go down there because if this is our patient, now she's coded and she's going to need to come back to a critical care room, not just the step down room. And we're going to need to know and probably help with that. So we get down there. It is in fact our patient. She has a pulse. They have intubated her. They're bagging her. We get her back upstairs. We spend the next 45 minutes to an hour getting her stabilized, putting her on the vent, art lines. Um, I think they had to attempt twice for an art line. They put in a central line. We got her on some medications, drew labs, all of those things. It takes, it took a few minutes. I was helping with that. I drew like a final set of labs because values change.
Post
First labs,
intubation.
postcode,
Yeah.
like once you've stabilized. So we drew a final set of labs. I was getting ready to send those down. I'd walked out of her room across the hall to the tube station to send them to the lab, and I got um uh, that's when I was made aware. The primary nurse that had previously had her approached me with the lab bag in hand that I had given him containing what I believed to be Versed, asked if that was what I gave the patient. I looked at it. I could see the writing on there. That was the order. Yes, it's what I gave her. It's not Versed, it's vecuronium.
Oh wow, Vecuronium's a paralytic.
At that point, please give this to the charge nurse. Let her know what's happened. I run through that quickly because I can recall this, but
Yeah.
the feeling of like, what have I just done? What have I just done? Like, everything just leaves your body. I've heard people describe that when they're talking about things, like you just feel like your everything that's here is just, you know, it just could have been in the basement. So anyway, critical care anesthesiologist is in the room. The two nurse practitioners are in the room, and there's one, maybe two residents. I can't remember, at least one resident. They're in the room. They're having a conversation about what's
Is there
happened.
family? Is there any family
No,
present?
family is
Okay,
not present. The family was brought previously by the room, let them know, like, um, we're, we were doing sterile procedures at that point with the art
sure.
line and with the central line. Because normally, yeah, if we're actively coding and you don't know what's going to happen, we could talk,
Oh,
separately
sure,
about
sure.
what's involved with there, but you don't want to keep the family out of the loop. They need to know what's happening. So, you know, they were there. The charge nurse, was able to let them know what's happening. This is what you're seeing inside of the room. This is what we're gonna do. And so we had like a small private waiting area that they were able to come wait in.
So you
Obviously,
go in and you
yeah,
say what?
I let them know, I'm like, hey guys, so I had already told them that she'd gotten a milligram of Versed while she was downstairs. I told them at some point, I think on the way up, transporting her, and then again at some point while we were in the room, I just wanted everyone to know, like, she's had a milligram of Versed. If you're looking, at the MAR,
Yeah.
whatever, just
Because
I'm an over communicator anyway.
yeah.
So I wanted them to know. So that had already made them aware that I'd given her, a milligram of Versed. So then I was like, hey guys, I, that milligram of Versed that I told you I gave her, I didn't give her Versed. I gave her vecuronium. You know, I think everyone in the room, we were all on the same page. We didn't have to say it. Like, no one, we didn't have to say. We all knew. Um, Nurse practitioner that was in the room, Lindsay, she just said, "I'm so sorry." Like, she could obviously see it on my face. We all knew that this was not going to be a good thing. For the first almost year, no one knew. But actually, until I was arrested, which was February of 2019, and this happened
That's a
late
true
December of
story.
2017,
Wow.
people didn't
Yeah.
know. So only the people that I chose to tell knew what was happening. People close to me, my family, um, a couple of people that were close knew, but the majority of people, the general public didn't know. It wasn't until I was arrested and things were public that, people knew. Um, and I tell this to other nurses that have reached out to me. Tell people what's going on. Tell people what is going on around you. Okay. They need to know, because to hear someone talk about this all at once from an outside perspective, like the news does when a nurse gets arrested for accidentally giving the wrong drug to a patient and killing them, what's your first thought? It's hard to believe, this is too much, that's crazy, right? you need to be letting the people around you that are going to be there to support you, let them know what's happening. They need to have a basic understanding of what's happening so that they can be there to support you, so that they can watch for the differences. Because trust me, they'll notice that something is wrong with you. All of these nurses that have reached out to me that I have talked to over the years, we talk about this. And they're like, yeah, they know something's wrong. They just don't know what. You are not okay.
Right.
You tell yourself you're okay. You look in the mirror and you're like, I got to pull it together. Some people cry and cry and cry. Some people just like, you know, you just you try to disassociate and become a human robot. Um, you know, Neither of those things are healthy, and I did both, and it was very hard. I never had thoughts of harming myself, but there were certainly days when I was like, I don't even deserve to be here. I don't deserve to be here. I, I don't deserve to take a shower. I mean, when I tell you the weeks that I did not shower, wash clothes, wash my hair, like I did not take care of myself. Um, and I spent a lot of that alone because my husband was working out of the country. We don't have kids, so it's just me here. It was difficult. Once it was public and people knew what was happening, then it was a lot easier for them to offer up help,
Did
or at
you
least just
take the help? Did you have problems taking the
it
help?
took a while. Again, and I tell this to nurses, we're the worst. We're the worst
Yes.
about taking the help. We're the worst about it. And the other thing that I did was, I talked to my nurse practitioner and I was like, I can't stop crying.
Like your
Everything,
provider, like she was your
yeah.
provider. Yeah.
My provider. I can't stop crying. Like I don't know what to do, with myself. I just know that I can't function like this. Something has to give. I need help. So I started an antidepressant, and that helped. A lot of people think like, oh, that's just, that's for someone who's weak-minded. No, mental health is, you know,
Real.
your brain is a part of the body, people.
Yeah,
Okay? Like,
exactly. Right.
um,
And let's just pause here for a second because I don't want people because I've heard, because I have mad love for not only you, but for people in general, nurses, and for the pay, for the person that's deceased. And so I don't want people to get the misconception that we're somehow being callous, that we're talking about someone deceased, because that's not it at all. We have, I know that you do, and I don't want to speak for you, but no, our heart goes, of course, out to the family. This is
yeah,
about education. This is about when
this
we
is
educate
about
nurses,
education,
it's
and
about patient
I
advocacy and
will say the
preventing
patient's
things.
name. Like, the patient's name was Charlene Murphy. She was a real human.
Yes,
She was
thank
a real
you.
human with real family. And it's hard. Like, this is where the emotion comes in that you're trying
Right,
really hard to hold back. Be talking about this before bringing that up when we say the patient. It's because there's a thin line between being a professional and keeping your shit together and breaking down because you've let the emotions come in. And
right,
now it's going to be really hard for you to do the difficult tasks and to look at this person as this is a patient and I need to do the practical and right, correct things to save and treat this patient. If you stop and you let the emotions in, it's going to affect your ability to professionally perform the things that you need to do to the standard that you need to do them. There is a boundary there. And when I'm talking about that now, this is the same way that I was trying to have this conversation when I told the Tennessee Bureau of Investigation about it. And do you know what she accused me of in court? Of having no remorse.
see, and that's why I wanted to pause
Again,
here for a second. I think it's
these are
important to
things that
know.
people don't understand.
And yes, because and again, I don't want to, we have jested a little bit. But it is a very serious topic. RaDonda and I take this
Yeah,
very, very serious. Part of our gift to nurses is part of the advocacy, and it's not lost on us that the result of this was the loss of life. So I just want to make sure that
absolutely.
we don't take this lightly at all, just so, because I've heard some things that I don't
The
agree
whole
with.
point of talking about this
Yes.
is so that someone else doesn't lose their life. I could give a shit about my license. I don't care. Like, I could have gone to prison and I would have figured that out. I can't fix this. I can't bring someone's life back. And it doesn't matter how old, how young, what the background is, what the socioeconomic status is, your religion, your sex, how you identify. It doesn't matter. None of those things matter. Human life is human life, and it is our job to take care of people and keep them safe. I didn't do that. You know, there were multiple things that failed along the way, including myself. And I can't bring that back. Um, the things I have learned and what people ask me commonly, would, knowing what you know now, would you have still gone back and reported? Absolutely. Please don't not report.
Thank
In
you.
fact, I would go so far as to say report everything. Every single time you have to work around
Yes.
whatever your facility says to do, that is an incident report. Every single time. And I know that's a lot to ask. I know it's a lot to ask. But you are going to have to take ownership of your own problems here. Because guess what? You guys are on your own. No one's coming to help you. The facility isn't coming to help you. The board of nursing isn't coming to help you. Your state, your ANA people, they're going to advocate for some things, but they don't know what's going on in your facility, right? This is your responsibility. And if you continue to engage in the workaround, you are going to be responsible. In fact, you are.
It's
You are
negligence.
responsible when the problem happens, just like
Yes.
I was responsible. I continue to engage, I was responsible. That's what I would do differently. Report everything, okay? We have an obligation to keep people safe. Report everything. Report every single thing. Eventually, your managers get tired of it. But guess what? If they retaliate and fire you, is that where you want to be anyway? No. Go find another job. Go push Botox into people's face.
Yep.
Go push carts back into Walmart. All right, because they're paying just about as much money. It's not worth the things that you are going to go through when you make a mistake and something bad happens. I can tell you that right now. Number one, report everything. Number two, do not talk to anyone without an attorney. If you are reported for any reason, if something happens for any reason, all right, do your research now. Look into your state area, figure out who people are using. And it can't just be, a criminal attorney can't do everything, an administrative attorney can't do everything, a civil attorney can't do everything. Find out someone who specializes in representing nurses in your area so you at least know, and have some kind of insurance. Look into the policy, know what it's going to cover, all right, to protect your license, because the facility is not going there. That attorney works for the facility. Their number one goal is always going to be the facility, not you. By proxy, some of them may be good to you, and I've heard ones that have, but you still need to take care of yourself, okay? Because this is going to get very expensive. That's going to fall on you ultimately. And finally, this career does not define who you are. This is not a career for martyrs. This is a professional choice. Okay? You have no obligation to anyone other than yourself and the people that you love. And if you can't take care of yourself and realize that you have a job, and at the end of the day, you leave that job and you leave everything there with it, and you take care of yourself, then you are doing yourself a disservice. Okay? You don't owe this career anything. And I don't care if you've only been in it for 3 years, for 3 months, or for 30 years. You owe it nothing. You owe yourself everything. A mistake doesn't define you. Being a nurse doesn't define you. Okay? It may seem like you have worked so hard, and I completely understand that. And to the thought of giving that up or walking away or letting it go seems mind-blowing. But there's nothing more important than your own mental health and your own well-being. Know your boundaries, right? Be willing to be just as much of an advocate for yourself as you would for your patients. Because if you're not taking care of yourself, if you are not maintaining guardianship over your license and your practice, you are doing yourself and your patients a disservice.